Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with celiac disease, wheat allergy? Find out more right now. My guest this evening is Dr. Alan Ehrlich and Alice Bast of the Beyond Celiac organization. Alan, Alice, welcome to Housecall.
Thanks for having us.
Our pleasure.
Wonderful to be here.
Great. So why don't we start off with you, Alan? Tell our viewers about your professional background and how you came to be actively involved with Beyond Celiac.
Sure. So I'm a family physician up in Massachusetts. I'm also on the faculty of the University of Massachusetts Medical School, and I was living a otherwise ordinary existence until about 10 years ago when I myself got diagnosed with celiac disease. And I'll talk a little bit more about that later, because it affects, how we think about the disease and who are the people you might think have celiac disease. But in any event, after I was diagnosed, I got connected with Alice by a cousin of mine who knew her and had attended one of the symposia that Alice had put together. And I became more involved with the organization. And now I'm the board chair of Beyond Celiac. And I'm, doing everything I can to help people with celiac disease at this point.
Very nice. Very nice. And Alice, let's go to you. Tell us about your background and how you became so active with Beyond Celiac.
Well, thank you, Dr. Doman. So I have celiac disease as well. And I came from working with Siemens and Hewlett Packard, but you're going to hear more about the signs and symptoms of celiac disease, but it took me 8 years to get properly diagnosed with celiac disease. So I had a full-term stillbirth, 3 miscarriages. My youngest daughter was only 2 pounds when she was born. And, at the time when I was finally diagnosed by the family vet, there wasn't gluten-free food in the supermarkets, I decided that I needed to make a difference. So started Beyond Celiac initially to make sure that gluten-free food was available and affordable and accessible. And now we're accelerating treatments and a cure for celiac disease.
Good for you both. So Alan, one physician to another, why don't you define for our viewers, the general public, what exactly is celiac disease?
So celiac disease is an autoimmune disorder that is triggered by the presence of gluten in the diet. And once this autoimmune disorder has taken place, it can lead to multiple manifestations in the body. That some can be very serious. And as you heard with Alice, it can affect her. It affected her ability to have children, and it can affect major effect on people's quality of life. And it can lead to just such a wide variety of symptoms that I think many people are unaware of, that it really needs to be viewed as a serious, it's a genetic disease, a serious genetic autoimmune disorder.
How common is celiac disease in the USA?
About 1% of the population is thought to have it. Some studies say up to 1.5%. It's a hard question to answer because many people who have celiac disease have never been diagnosed. This is because the symptoms can be similar to other conditions, such as irritable bowel disease. Studies that have attempted to determine what the true prevalence is usually rely on antibody tests, although these are not perfect. But if you look at antibody tests, about up to 1.5% of people may have celiac disease. And again, many of these people have never been diagnosed, and some of these people may not even have symptoms that they recognize as being abnormal.
You mentioned some of the more dramatic symptoms. My understanding is that there is a little bit of a dichotomy, a difference between the way children present with celiac disease as opposed to adults. Can you share with the viewers some of the differences in celiac presentations in the pediatric population versus the adult population?
Sure. So in children, they often have what are the more classic symptoms of things that affect the gut. And that can be diarrhea, constipation, a lot of gas, nausea, vomiting, abdominal pain. And in particular, many, particularly young children, may have what we call failure to thrive. And that's where they're not gaining weight properly. You can have children have cyclic vomiting where they're just throwing up all the time. And so they're unable to be properly nourished. The way celiac disease affects the intestines is it interferes with the part of the intestines that are that's responsible for absorbing nutrients. And so these children can become emaciated, just very sickly. The other thing that can happen with children is sometimes they'll have abnormal behavior. They may act out when they get exposed to gluten. These are more neurologic type symptoms, and they can occur in children as well. In adults, the symptoms are more varied. And so in an adult population, it may be very subtle. Sometimes it's someone who has iron deficiency anemia, which was my case, and that's how ultimately a diagnosis is arrived at. Sometimes the liver may just be a little bit inflamed, and a doctor may pick that up when they do blood work and they see liver enzymes are elevated and there isn't a good explanation. And these people have celiac disease. Some of them also will have the typical gastrointestinal symptoms, the diarrhea and things like that, but it can be more varied.
And Dr. Doman, we're starting to see that like half of the community of adults, we call it, have neurocognitive issues, which, Alan was talking about, where they have that depression, the anxiety, the peripheral neuropathy, the tingling in their fingers and toes, and the brain fog. We all know brain fog now from COVID, right? People are not able to spit out the words. And one thing that we don't always talk about is the dental enamel defects in children. So that's something that, if somebody's looking out, if they're seeing that their children have little dental enamel defects, that might be a reason to get them tested for celiac disease as well.
Yes, when I've lectured to dentists on celiac disease, I point out their patients may have cavities in unusual places because of that.
Yeah. One of the things that's different between adult and children that you're asking about, the children tend to be diagnosed relatively early. They will shortly after weaning, or often by 2 years of age, the children are having problems. And then this becomes a lifelong thing for them. Before we were able to do blood tests to detect celiac disease, I think the majority of cases were thought to be in children because they presented so dramatically, very malnourished. Now, the latest data shows that well over half, probably close to 70% of new cases are being diagnosed in adults. So it's a subtler form of the disease. People can carry on to some extent, although it does, have major repercussions. One of the things that is not absorbed well is vitamin D, and that leads to osteoporosis. So people who have premature osteoporosis are people who should, often are people turn out to have a celiac disease.
Yes. And Alice, when you introduced yourself and your background, it's actually quite typical of an adult celiac, where they will go on for many years, often seeing multiple different specialists, and nobody tied the whole diagnosis together with celiac disease.
No, you're right. It took 23 doctors to figure it out. And whatever the symptom was, they treated the symptom rather than the underlying cause. And they even told me that I was too tall to have celiac disease, and they had never seen an adult patient with celiac disease. So I was just really, I was glad I got the diagnosis, because my mom had died very young of pancreatic cancer. So of course, that's what went to my head, what was wrong with me. And I just felt fortunate that it was actually between my dentist and the veterinarian that came up with the diagnosis. And I went back to the gastroenterologist and insisted and said, please test me for celiac disease.
If I'm curious, how did a veterinarian get involved with your care?
I was taking my dog to the vet, and the vet noticed that I'd lost so much weight. Yes. And she asked me, asked me what was going on. And I told her my signs and symptoms. And she said, you know what? Sometimes animals have trouble with gluten. And it's different, but you know what? Tell me about your diet. And my gastroenterologist had me on a high carb diet. And I
Yeah.
told her that. And I told her that I was, I knew every bathroom, from, around the building that I worked in. And she said, ask your doctor to test you for celiac disease. And he actually, when he said no initially, and then finally said, all right, I'll test you. And was very surprised when those antibody results came back. And then the endoscopy, my villi were flattened.
Wow. Great story. Well, I'm glad you're doing better now.
Oh, yeah.
Alan, you diagnose somebody with celiac disease. How do you go about doing that?
If you think somebody might have celiac disease, the standard screening test is to do an antibody test. And it's an antibody against something called tissue transglutaminase, which we call TTG. And I'm just going to call it TTG for the rest of this discussion, just to make it simpler. But if this is elevated, it can be a sign that somebody has celiac disease. It is not 100% proof, although if it's very, very elevated, in some cases, it can be taken as sufficient for diagnosis in the presence of other features that go along with celiac disease. But typically, you'll start with the blood test that we call serology. And if that's elevated, then the next step would be to have confirmation by having a gastroenterologist do a test where they put a scope down into the stomach, an endoscopy, and then they take biopsies. And the biopsies are looking in the area of the small intestines, and the area where we absorb our nutrition are called the villi. And as Alice mentioned in her case, the villi are flattened, and that's the result of chronic inflammation. And when they're flattened, they don't have the ability to absorb nutrients. And so you get the diarrhea and you get the malnutrition that ensues from that. So it's really two steps. First is the blood work. Then there is the test for looking at the small intestines, the little biopsy that's done. One thing that is of note, in order to be tested and have the test be reliable, a person has to be eating gluten. This is a critical point because many people think I might have celiac disease. I'm going to go off gluten, and then they feel better. And then it becomes very hard to tell if they in fact have gluten, whether they have celiac disease or some other gluten-related illness. And there are others. And so I always tell people, if you think you have celiac disease, get tested before you go on the gluten-free diet. Because if you're already on the gluten-free diet and you feel well, and then you want to know for sure, you now have to go back on gluten. You may then subject yourself to symptoms that are even more severe than they were when you stopped. And many people are very reluctant to do that for understandable reasons. If I could add one thing to this notion, I found, and I was told this by my cousin who I alluded to, that once I went on a gluten-free diet, when I then had gluten, my reaction was even more severe than it had been originally. And the way I like to think about it is when I was eating gluten all the time, my immune system was exhausted. It was constantly fighting. And once I was on a gluten-free diet, I had a chance to re-energize and recharge. And so now when I get exposed to gluten, I get the full force of my immune system wreaking havoc on my intestines.
Makes a compelling case to avoid gluten. We're going to pause briefly for a public service announcement. More with our guests, Alice Bast and Dr. Alan Ehrlich of Beyond Celiac, and we'll be discussing more about celiac disease in a moment. We'll be right back.
Life doesn't always give you time to change the outcome. Prediabetes does. With early diagnosis, prediabetes can be reversed. Take the 1-minute prediabetes risk test today. Go to doihaveprediabetes.org.
We're back. My guest this evening is Dr. Alan Ehrlich and Alice Bast of Beyond Celiac, and we're discussing celiac disease, wheat allergy. Alan, when we paused for the break, we were discussing gluten-free diet and its importance. So tell our viewers what exactly is a gluten-free diet. Describe what foods in particular they need to avoid.
So the first thing to understand is, well, what is gluten? And gluten is a culinary term. It is not a medical term. If you take flour and you keep washing it, so you get rid of all the carbohydrates that dissolve in water, you'll have a sticky mess left. And if you've ever baked bread, this is like what you want. That's gluten. That's all the proteins that are in there. And the grains that have these proteins that are very sticky and elastic that make for great bread are wheat, rye, and barley. Those are the three foods you really have to avoid. Now, some people ask about oats. Oats are very interesting because pure oats are usually tolerated by people with celiac disease, but not always. There's a small percentage of people who cannot tolerate oats, even if they're pure oats. But even for people, the vast majority of people who can tolerate those oats are frequently processed with the grains that cause trouble, and there's a lot of cross-contamination. So for instance, myself, when I buy oats, if I want to have oatmeal for breakfast, I have to make sure it says gluten-free oats. Because of this problem of not knowing who's going to tolerate oats and who doesn't, the standard advice is that if someone is diagnosed with celiac disease, they avoid wheat, rye, barley, and oats. And after they've been established on a gluten-free diet for a period of time, 3 to 6 months, they can introduce oats and see if they tolerate it. But the foods, it's easy if I say, avoid wheat, okay? You're not allowed to have anything that has wheat products in it. Well, what is wheat? Wheat comes by different names. You have semolina, like in pasta. There's farro. So when someone who has celiac disease is reading a menu or reading ingredients on a label, they have to be sure they know what all those terms mean and which ones signify potentially troublesome foods. I know Alice knows a lot about the importance of that gluten-free diet and educating people about that.
When you educate people about gluten-free diet, do you say you can just eat reduced gluten, or must they go total zero gluten?
Oh, zero gluten. You have to be 100% gluten-free, which it also means no cross contact or no cross contamination. So they can't even have a particle of gluten because that will set off the immune reaction. And, what you see is, we're hearing about common foods like pizza, cookies, cake. But what some people, don't know is something like soy sauce is not made. The main ingredient in most soy sauce is not soy. It's actually wheat. So people cannot have soy sauce as well. And if you order something and let's say they put a bun on a hamburger and they pull the bun off, there are particles left on that hamburger and you cannot eat that hamburger. You have to be 100% gluten-free.
If I could add to that, sometimes people will say to me, Alan, do you ever cheat on the diet? Okay, because people who have diabetes will sometimes have a piece of cake when they know they shouldn't. Yeah. Never. I never deliberately have gluten because it would make me sick in a way that's very, very unpleasant. So, it is zero. But it's also important to know that if something says gluten-free, it doesn't always mean there is no gluten in it. The FDA defines gluten-free as less than 20 parts per million. So if it's a very, very tiny amount, it's felt that people with celiac disease can tolerate that amount. Some people are more sensitive than others. So, there are some things that are truly gluten-free because they're naturally gluten-free, bananas, avocados, things like that. But when you start dealing with something in the store, you have to be a little careful because just because it says gluten-free doesn't mean there is no gluten. I know there was an interesting bit with Cheerios not long ago, and I know Alice had something to do with that in terms of, although it was labeled gluten-free, people getting sick.
And eating out in restaurants, when we're thinking about, going out to eat, one of the things that the chef may not be aware of is that gluten is a protein, right? It is not a bacteria. So you can't boil it away. So if oftentimes the restaurants reuse the water, and you have to make sure that when you're requesting something that you say, I need fresh water or clean water, because if the water's been used for pasta, they can't reuse that water for, let's say, for vegetables or something that you're going to be eating. It's complicated, huh?
Yeah, it's a challenge, but it is getting easier, as you know. As I'm sure you both know, there are even gluten meters available where people can test their food. Yeah. Do either or both of you do that when you go out to eat?
So my kids had given me the testers that you can use at the point of care. I don't use them. I try to go to places where I have high confidence that I can trust what's being done. And in Massachusetts, where I live, it's the public health is very aggressive about making sure restaurants understand allergen awareness. And in fact, I'm also currently the chair of the Board of Health in my town. So I make sure that all the restaurants around are doing what they're supposed to. And it's pretty good up here, but it isn't that way. And when I travel, it's much riskier for me. So it is something that is a problem for me.
Dr. Doman, I used to use one, and every once in a while I use it, but it's the fact is you're getting one, you're not getting the whole plate, right? So you're, and people look at you. I find that, as Alan was saying, if you can find restaurants and places that you can frequent and, make sure that you go on off hours, that you're better off being able to eat 100% gluten-free that way. But if you're traveling or you're, a child in school or somebody in a college environment, just think of the school cafeteria. It's really hard to navigate that cafeteria.
Yeah. As I'm sure you both heard, the Europeans have been ahead of the Americans on celiac disease for many years.
You would know Italy is fantastic, right? You think of all the pasta, and Italy is like somebody with celiac disease. When they go to Italy, it's really a great, all the restaurants are very well aware of the gluten-free diet and understand cross-contamination.
Sure. So given the challenges of embracing a gluten-free diet, what are some of the exciting research opportunities that are out there for alternative therapies?
There are a number of ways. There is research on medications to help treat celiac disease. Currently, there are no medications. The only treatment is the gluten-free diet, and the gluten-free diet does not work for everyone. About a third of people still have ongoing symptoms despite the gluten-free diet, and upwards of 40 or 45% of people will who are otherwise well controlled will have inadvertent gluten exposure that will trigger them on a once a month or so. So again, I have to live a life, and so I put myself at risk. And for the most part, I'm careful and things are okay. But I myself get exposed to gluten from time to time, and so we need some type of medical therapy. And I believe that celiac disease is probably the most common medical condition for which no therapy from a pharmaceutical perspective exists. There are a number of lines of attack of how you could develop such a drug, and many of these are currently in various stages of testing. But you could imagine that you have some type of pill that you take that breaks down the gluten before it gets into the intestines. And this is similar to what people who are lactose intolerant, they take an enzyme pill that helps them break down the milk. Well, in our case, we don't need to break down the gluten. The problem, in order to not have the digestive problem, we're worried about the antibody reacting to it. So we have to break it down before it gets into the intestines. So that's one way that might happen. Another is to develop tolerance. So just as people who have other types of allergies, like allergies to hay fever and things like that, can go for allergy shots, and the immune system gets used to it and realizes, no, I shouldn't be reacting to the substance. It's okay. If we could do a similar thing where we could get intolerance to the immune system to not think that gluten is a problem, then that would be another way. A third way is they've got now targeted antibodies, and you could actually try and dial down the specific antibodies that are responsible for the reaction. And you could also do something that might block the reaction at the level of the intestines. Okay, we release antibodies, they go after the gluten, but somehow you protect the intestinal lining. And then finally, you could take something as people who have things like Crohn's disease or ulcerative colitis take, that really dials down your immune system across the board. But that's probably a scary thought for a lot of people with celiac disease. These more targeted therapies would be much better.
Let's circle back then. And Alice, please chime in if you have any comments here. Circle back to each of these options you mentioned. Let's say the pharmaceutical approach, where you can take it just before consuming gluten. Where are we with clinical trials, and are you involved with coordinating it?
You know what, there are about 15 therapies right now in clinical trials. And on our website, we at Beyond Celiac, we actually have a clinical, you can see all those clinical trials, what Alan was talking about. And we are actually the lead enroller right now in clinical trials, because it's really important if we're going to have treatments and a cure for celiac disease, right? We have to have patients sign up for those clinical trials.
I would imagine your organization is the perfect conduit for coordinating the research and recruiting volunteers.
Yeah, we are coordinating the research, and we have and enrolling volunteers. We actually have a 360 approach, I call it, where we advance. We currently are investing $4.5 million into translational research. We have the science plan where we're looking to make sure that what we fund in research matters to patients, right? We'll bring therapies, treatments, and a cure to those with celiac disease. But then we also have a second leg of our research plan where we focus in on evidence generation, right? So understanding more about the patient's experience, how they live their life, and then being able to enroll them in clinical trials. And what we haven't talked about yet is the fact we also are focused on making sure everyone is properly diagnosed with celiac disease. You know, we have to make sure there aren't racial disparities, and we're very busy working on that as well. And then lastly, we have an area where we're focusing in on just directly investing into biotechnology as well, so that we're able to make sure that our community can eat without fear. You know, that's our vision, is to be able to eat without fear.
Sure. Tell us about your dialogue with the pharmaceutical companies. Do they find that a potential patient population of, let's say, 3 million people in the USA is an adequate marketplace to make it research and development worthwhile for them? Or do you find you have to self-fund your own research?
Well, Dr. Doman, we've been self-funding initially, and we've been banging this drum for a long time. I tell you, we've been educating a lot of scientists and researchers and pharmaceutical companies, and now they understand because some of the studies we're funding, it's showing that there could be neurocognitive effects, and that people are not, they can do the best job they can on a gluten-free diet, but we absolutely need treatments and a cure beyond the gluten-free diet. And there is this marketplace, and there's going to be more and more investment into therapies, because our community deserves it. And the gluten-free diet is just, as Alan was saying, is a Band-Aid.
If I could add on to that, the FDA for a long time felt, well, there's a gluten-free diet, and so there isn't a need for additional therapies. I think they're aware of that now. When we talk to pharmaceutical companies, sometimes they're concerned about the usual things pharmaceutical companies would be concerned about. Is insurance going to pay for this if there's already a gluten-free diet? Are people going to be willing to take a pill if all they have to do is adjust their diet? And often the target audience is typically those people I mentioned before who continue to be symptomatic, even though they have they're on a gluten-free diet, they still have symptoms of celiac disease. And one pharmaceutical person we were talking to was saying, well, if we develop this drug for those people, then people who are well controlled on a gluten-free diet are going to just go ahead and take it just so they can eat gluten, and was speaking as if that's going to be a problem. And my response is, that's the whole point. People, we want people to be able to eat whatever they want to, and to be able to control this disease, so that, again, as Alice says, people can eat without fear and can try and have a normal life. And let me tell you, people with celiac disease have far from a normal life. Whenever I travel, the first thing I do is I have to investigate, where will I be able to eat safely?
Alan, a great way to close the show. Thank you both for a terrific interview. Thank you for my team at the studio, and thank you, the viewer, for letting us into your home this evening. You can reach me at the practice website listed on the screen. Our next show will focus on breast cancer diagnosis and management. See you then next time for another edition of Housecall. Good evening.